Section 17. Assessment needs and care during pregnancy. Introduction. In the previous study section, you have learnt the role and responsibility of the midwife in prenatal care. This study section will introduce you to how to assess needs and care during pregnancy. In this study section, you will be discussing the expectant mothers, where the following will be considered: general physical examination, abdominal examination, and how pelvic assessment is conducted. These procedures play an important role in ascertaining normality. Learning outcomes. At the end of this study section, you should be able to 1. Describe the general physical examination of the woman prenatally. 2. Explain how to conduct examination. This includes inspection, palpation, and auscultation. 3. Highlight how pelvic assessment is conducted. General physical examination. General physical examination involves a head-to-toe physical observation. The head is examined for lice and dandruffs. This could result in anemia and disturb sleep. The conjunctiva and the lips are observed for paleness. If the nose is discharging, this will indicate upper respiratory tract infection. The tongue, phlogocyphiles, and dental caries is also identified if any. The fingernails are also examined for pallor. Height of over 160 cm is indication of normal size pelvis. Conversely, abnormally short stature may indicate contracted pelvis. Weight should always be measured using the same scales, and the woman asked to wear similar clothing each time she is weighed. Obesity could be associated with gestational diabetes and pregnancy-induced hypertension, PIH. Blood pressure is monitored in order to ascertain normality and provide a baseline reading for comparison throughout pregnancy. She should always be in the same position to ensure a comparable reading. An adequate blood pressure is required to maintain placental perfusion. Systolic blood pressure of 140 mmHg or diastolic pressure of 90 mmHg of booking is indicative of hypertension and could cause damage to the placenta. Factors that increase accuracy of blood pressure measurement and recording. Urinalysis. Urinalysis is performed to exclude abnormality like asymptomatic bacillurial ketones due to increased maternal metabolism caused by fetal need or because of vomiting. Glucose caused by higher circulating blood levels, reduced renal threshold or disease. Protein due to contamination by vaginal leukorrhea or disease such as urinary tract infection, UTI or PIH. Abdominal examination. The aim of abdominal examination is listed below in figures of a diagram: to observe signs of pregnancy, to assess fetal size and growth, to assess fetal health, to diagnose location of fetal parts, to detect an deviation from normal. Abdominal examination includes inspection, palpation, and auscultation. Inspection. Inspect the abdomen for size, scale, striae, and gravid arum and linear nigral. The shape, whether it is oval, globular, or pendular. Palpation. Palpation includes further, lateral, and pelvic palpations to determine the height of fundus, fundal presentation, and engagement of the presenting parts. Palpate as follows. Further palpation. To find out what is in the top of the uterus, face the woman's head. Put your hands on both sides on top of the uterus and cuff your finger around. Palpate for shape, size, firmness, and how easily the baby moves. If the fetal head is in the top of the uterus, you will feel a round, hard part which is movable. If the buttocks are felt, they will be irregulated, bulky, softer than the head, and the top of the uterus will feel full and not easily moved. Diagram of a pregnant woman on palpation. Lateral palpation. Continue to face the woman's head. Place both hands further down on the abdomen. Push down with one hand, pushing the fetus to the other side of the abdomen. Feel the fetus so that you can tell the parts. Gently move the baby from side to side to more easily tell which side has the back and which side has the arms and leg. Pelvic assessments. A pelvic exam is a way for doctors to look for signs of illness in a certain organs in a woman's body. The word pelvic refers to the pelvis. The exam is used to look at a woman's vulva, uterus, womb, cervix, fallopian tube, ovaries, bladder, rectum, reader's activities. 1. Continue to face the woman's head. Have the woman bend her knees. Grasp the parts of the baby in the lower part of the abdomen. Ask yourself, what is in the lower part of the abdomen compared to your findings of the first palpation? 2. Turn and face the woman's feet. Make sure that the woman's knees are bent. Place both hands on the sides of the abdomen and press them towards the pelvis. Compare the findings to the other side. Take 2. Compare the findings to the other palpation and figure out the presentation. Check if you feel more than one baby. Auscultation. Listen to the fetal heart rate. Normal rate is between 120 to 160 beats per minute. If the heart rate is above 160 or below 120 beats per minute, the baby may be having problems. Locating landmarks for descent. Landmarks used in measuring the descent are the fetal head and the maternal pelvic brim. Procedure. Stand at the side of the woman. If you're right-handed, stand at the woman's right side. Feel the head with your right hand. The head can be moved. When all of the head is felt, it is measured as 5 feet above the brim, i.e., 5 of your fingers can cover the head above the brim. When the baby's head is 4 feet above the brim, 4 of your fingers can cover the head above the brim. It is just entering the brim when it is 3 feet. 3 of your fingers can still go on partially round the head. When it is 2 feet above the brim, only 2 fingers. Take 2. When it is 2 feet above the brim, only 2 fingers measure the head because more than half of the head has entered the brim. You can no longer feel the roundness of the head. The head is now engaged. It is almost impossible to move the head. When the head is all the way in the pelvis, you cannot feel it abnormally. Study section summary. In this study section, you have learned that 1. General physical examination involves observing the expectant mother state of health physically and taking note of any deviation from normal. 2. Abdominal examination is conducted to observe signs of pregnancy, assess fetal growth, and to detect any abnormalities. 3. Pelvic palpation is used to judge the size, flexion, and mobility of the head, determine position in a vellus presentation. End of study section 17. Thank you for listening.